we know that calreticulin mutations can cause MPN and do cause MPN. We know that some patients will just have calreticulin as their sole mutation. They won't have any additional mutations. They'll just have a calreticulin mutation, and that on its own is sufficient to cause an MPN. And sometimes patients can present with ET, essential thrombocytosis, or sometimes they can present with myelofibrosis. We know that this is true particularly in young people. So in people under 40, it's uncommon to have an additional mutation. As you get older, you can acquire additional mutations, and these can sometimes result in a progression of the MPN. That is an area of active research, since we don't understand all of the factors that lead to progression. But what we do know is that calreticulin mutations alone can cause MPN. We know that different types of mutations, so there's two different types of mutation, type 1 and type 2, they can be associated with different subtypes of MPN. So for example, the type 1 mutation, the 52 base pair deletion, is more associated with myelofibrosis than the type 2 mutation. And then, as I said, sometimes when patients progress, they can acquire additional mutations in other genes outside of calreticulin. And these, in some cases, not in all cases, but in some cases, these can be associated with progression.